Hello, everybody. This is Ramin Azar, licensed clinical social worker and owner and operator of Flex to Success Clinical Rehabilitation Services. And today I'm going to do a video on dialectical behavioral therapy, also known as DBT. So, what is DBT? It's a type of psychotherapy that teaches individuals and groups the skills and strategies they need to navigate life's challenges, develop healthy social relationships, and self manage personal difficulties. This type of therapy was developed by Marsha Lineman, who primarily used it for patients with borderline personality disorder, although now, after current research, it can be used for depression, PTSD, eating disorders, bipolar disorder, and addictions. DBT has four key elements that it targets to enhance personal growth within individuals. The four elements are mindfulness, emotional regulation, interpersonal relations, and distress and frustration tolerance. So mindfulness. Mindfulness is it's focusing all your attention to the present moment. So one exercise that I like to do with patients to encourage mindfulness is I call it the repeat exercise. And basically what that is I'll read like an excerpt of something and I'll say, okay, repeat it back to me in your own words. It's a very simple exercise, and what it does is it draws all the patient's attention to what's going on in the present moment. If possible, you want to have an understanding of your clients of whether they're more creative or more rational and logical. Patients that are more left-brained or rational and logical, they'll tend to gravitate more towards very systematic, methodical exercises that are very like straightforward and to the point. Your clients or patients who are more creative, they will gravitate more towards cre- uh, exercises that involve creativity, lots of adjectives, lots of subjective interpretation. So for my more creative clients, I'll do the exercise a little bit differently. I'll say, pick an object in the room. You could pick that light behind me. You could pick the computer screen. You could pick a phone. You could pick a box. You could pick a chair. And I'll say, okay, now focus intensely on the object that you've picked in the room and just describe it to me in full detail for the next, minute or so. And then I'll just let them talk about the object for a full minute. Just that one object and nothing else in the room. And it's a great centering exercise to just bring the attention and focus to what's currently going on at the moment. Emotional regulation. So, this element of DBT is used for developing a strategy to change or manage emotions that are super intense and creating and for these emotions that are, basically, when your intense emotions are starting to create a problem in your life, it's this can be from not regulating your emotions. So if your emotions are so volatile that they're creating problems in your life, you can benefit from emotional regulation. So what we want to do here is we want to help you develop a strategy to manage your emotions in a way where they don't create, you know, problems at your job, problems within your personal relationships, problems at home, etc. So, an exercise that I like to use for emotional regulation is helping the client or patient to identify like a real or perceived event that the patient finds really stressful, verbally walking the client through that scenario, providing suggestions for positive coping skills or relaxation techniques along the way, and just kind of interjecting and getting the client to focus on specific aspects of their real or perceived event that could be the core components to focus on to being able to manage it better. So it takes a pretty skilled therapist to be able to do that. I've had a lot of practice with these types of patients, helping them to dissect some of these events or stressful occurrences that have triggered strong emotions for them. People who have been through traumatic experiences, a lot of times they'll have very specific things that they talk about when they're doing this exercise. So it's really helpful in getting to know your patients better. So interpersonal relations, how does this element address DBT? So within interpersonal relations, you're focusing on techniques that allow someone to communicate with others in a way that's assertive, allows for self-respect, strengthens the relationship overall in a progressive and healthy manner. So where do you have interpersonal relationships? You can have them with strangers, you can have them with teammates, you can have them with coworkers, your boss, right? These are all areas where you can have interpersonal conflicts, so to speak, potential interpersonal conflicts. An exercise that I like to use to strengthen interpersonal relations is role playing. Role playing is really effective when it comes to this. Um, I'll highlight, ways that you can be assertive while we're doing a role play. So, for instance, I'll be your boss, you be the worker, or I'll be the worker, you be the boss, depending on what your real life scenario is. How you are in your actual job world will dictate like how we do the exercise because I want it to be as real life as possible. And while we're doing the exercise, I'll say, okay, this is a great time for you to engage in active listening. As we progress through it, I'll say, okay, this is a good time to set boundaries. This is a good time to be assertive. And this is a good time to provide feedback. And I think sometimes just helping patients understand when the appropriate time is to do these certain things and then giving different suggestions on how to do them can greatly improve their social relationships in an interpersonal manner because a lot of times with interpersonal conflicts, there's misunderstanding. And a lot of times that misunderstanding could be something very slight and simple that's happening. That if you just tweak it a little bit, it can change the whole dynamic of the conversation or interaction. And the last core element of DBT is frustration or distress tolerance. So, what are we talking about here? Increasing the tolerance for embracing or enduring or overcoming um, negative feelings or emotions, right? So being able to tolerate when things aren't going well. If I were to break that down in very layman terms, that's how I would do it. When things don't go well, what is your ability to endure, handle, and move forward from that situation? Many of my patients struggle with this, and they don't necessarily have a diagnosis of ADHD or um, borderline personality disorder, okay? Sometimes they just have depression or they just have anxiety or they just have like something maybe not as severe, but they still struggle with this particular area because it's life coping skills, it's if you were abused in your background or um, if you've had bad experiences with trying to manage stress in the past, a lot of times that can spill over into your adult life. So you'll notice that some of your patients might have a pattern of maladaptive coping when it comes to facing certain situations. It might not be every stressful situation. It might be a very, very particular, specific situation that really gets under their skin. And, as a therapist, if you're doing good work with your patients, you'll be able to identify what those specific instances are and then help your clients to overcome them. So, one exercise that I like to do with frustration and distress tolerance is I'll identify triggers. So, what are some triggers that the patient is experiencing in real time, right? Meaning, like within like the past few weeks or however long it's been since you've seen them, um, and then exploring reasons for the intense reactions to these triggers. So, Just for a hypothetical example, let's say a patient is having, someone cut a patient off on the road, right? And the patient says, well, he cut me off on the road and I saw red and I chased him down and then we got to a red light and I stuck my head out the window and I just screamed at the top of my lungs like a bunch of different obscenities at this person and then I roared off at 100 miles an hour all the way to work. And I'll say, okay, um, so it seems like so what you're telling me is that, somebody cut you off on the road and you were so angry that you chased them down, you caught up to them, possibly endangering yourself and other people on the road. When you caught up to them, you stuck your head out the window, you started screaming obscenities at them. Right? It sounds like you were super angry. It sounds like you were super upset. Has this happened before? Uh, what are some other things that you reacted to in a similar fashion? Why did this get you so upset? Um, you know, and then just kind of going from there. And I think what you'll find out is that there'll be a pattern of this behavior occurring. This isn't the first time it occurred. There's a pattern of this behavior occurring in other similar situations where the patient lost their temper and reacted this way. And then you could say, okay, so I got an idea now. What are some of the instances that really set you off and trigger you? Now let's develop a plan on how to manage these triggers so that this doesn't happen again. Um, so those are the four key elements of dialectical behavioral therapy. We covered some exercises that you can do with your patients to try and get a better understanding of not only the patient, but how they react to things, how they cope with things, how they work through things in their lives that are challenging or causing them to struggle. And DBT is a great type of therapy because it really helps you take a deeper dive into what the core issues are that are going on with the individual. And anytime you're doing therapy, you want to identify patterns and you want to get to the core of what's really bothering the person so you can really help them get through it. And DBT covers both of those bases, which is nice. So that's my presentation on dialectical behavioral therapy. If you have any questions, please leave them in the comments below. I'm always open to hear everyone's feedback on these topics. And hopefully, this has been educational for you. And I hope to see you guys next time. Please like or subscribe if you enjoyed the video. Take care and enjoy the rest of your day. Bye, guys.